viewers, we are reminding you again that you are watching the Discovery Show, a show that seeks to interview professionals in the diaspora. And we are here interviewing Dr. Justice Boachiapia, a medical doctor who is a PhD student, almost completing, and his interest is in Buruli Ulcer, tuberculosis, and all that. Dr. Boachiapia, I know that you were actually a consultant in the WHO during 2015 in the Ebola period in Liberia, and you also worked as a clinician on a trial between 2014 and 2016. Will you want to shed a bit of light on both for us?
So the trial was what I spoke about, the drug trial for Burial Ulcer. So the Burial Ulcer disease is not, it has been known in Ghana for a very long time, but it's not the most common thing. It's quite focal. So, you have hotspots, the Agogo area, the Afram Plains area. You have cases even in Accra, somewhere around Amasaman. You have clusters there. So it's quite a niche kind of thing. And Prof. Phillips he's currently like the global clinical authority. Everybody. He's the one that everyone calls on if they have any questions on Buruli Ulcer clinically.
Okay.
So because I used to run the clinics as a clinician, at the time treatment for Buruli Ulcer previously used to be surgery. You had to go for surgery to remove the wound. It was quite nasty wounds. You had people come in very nasty wounds. And then later on, they found that antibiotics could work. So they were doing an injection and an oral antibiotic for 8 weeks, which was difficult. Every day, an injection for 8 weeks. Now, some preliminary data had suggested that they could go only oral. So instead of the injection was streptomycin. So it used to be streptomycin and rifampicin. But now, some preliminary data suggested that clarithromycin, which is a tablet, and could replace the injectable. So instead of taking one injection, one tablet every day for 8 weeks, now you could take 2 tablets every day for 8 weeks.
Okay.
So the trial was to ascertain whether or not this was true and this was possible. So it ran for I think about 3 years, and we had 4 centers, and there was a site in Benin as well. It was Ghana and Benin as well. The paper has recently been published in the Lancet, which is a huge thing. I think impact factor of about 69 or something. So
69.
Wow. So it was big. It's one of the highlights. It was a huge thing. If it turned out that the clarithromycin was actually a good replacement for streptomycin, so currently nobody does the injection. You take the tablets, and then. But while doing the trial, that was when Ebola came up in West Africa, in Sierra Leone, Liberia, Guinea, and so on. And at the time, Ebola, like COVID, when these things happen on large scale like that, they sort of break down the whole health system, crumple everything, break everything down. So Liberia had suffered so badly that the entire health system had basically been run down by everything. So the WHO tried to help them by revamping their various disease control units.
Okay.
So they had TB, they had Buruli Ulcer, they had, I think, was this schistosome? They had some disease control units under their Ministry of Health. The WHO wanted to revamp these, so they wanted to do, leprosy was one. They wanted to do an assessment of the situation, and then update their national registers and sort of strengthen the program. So they were recruiting people to consult in the various areas, and they reached out. They wanted Prof. Phillips to go, but I think at the time he had some other engagement? Something happened, and he said he rather recommended me to go. So I think I when I met the Afro director, as they call it, Africa Regional Officer in Liberia, he looked at me with a very suspicious eye. What is this small boy doing? What's this small boy doing? Because all the health consultants were very old people. These were old, accomplished doctors. And then I was the youngest was probably twice my age. I think I was about 26 or 27 at the time. So the driver who was supposed to take me around the country, when I got to Liberia, he asked me where, in their kind of English, where your papa? Like, where's your father? So he thought I'd come with my father.
You don't know what
I shook my head. But it was a good experience. So we traveled around the country, and I keep saying war is a terrible thing. War is a terrible thing that messed up the country. Traveled around seeing patients with Buruli Ulcer and leprosy, treating patients, training. They didn't even have doctors. They had some medical assistants who had done some 2-3 year courses who were acting as doctors. So training them and things like that. It was a good experience. After that, fortunately, I didn't get infected with Ebola or anything. After that, I came back home to continue my housemanship. I was still within my training, so I came back home to continue. But it was a good enlightening experience. It opened me up to a lot of things.
Doc, let's shift a bit from research. We might come back to that in the course of our conversation. You mentioned that or based on what you said, it means your life really cut across almost all areas, and we can call you an all-round person. You have also stated on your professional LinkedIn account that your hobby is writing for religious, social, and political issues, or about political issues, religious and social issues. Can we find out from you what your opinion is when it comes to some medications that are paraded out there as cure for certain diseases, but in essence they are actually just food supplements?
I think you want me to go into very controversial. It's very controversial. In the past, I've sort of been involved in, I wouldn't call them arguments, but debates with colleagues who have been involved in this business of selling food supplements as cure and things like that. I wouldn't want to zone in on one. Let's have a broad conversation on medications in general in Ghana, I think we need a lot of regulation and streamlining of how things are done. People sell all sorts of things, herbal concoctions, even hospital medication, even in the pharmacy. The way medications are. There are some drugs that are not supposed to be sold without prescription, but in Ghana you can basically get any drug at all you want if you walk into a pharmacy. But ideally, things like antibiotics, you shouldn't get them without a licensed or authorized person prescribing them for you. So it's a broader conversation, and a few times I've written on these things in the newspapers, and I write under a pseudonym when I'm writing controversial things, so people probably will not be able to direct it to me. But a few times I've written on these things and made comments on how I think we need to, if we believe herbal medicines are the way forward, which I don't doubt at all, because even the orthodox medicines have their basis in plants. I think we need to streamline it, make sure all the drugs are trialed. We may not necessarily have to organize trials on the scale of the West and the scale, because we may not be able to afford it, but we can have tailor-made trials in our own way to ascertain the veracity of the claims of these herbalists. But because working in Ghana, it's frustrating. You find people with hypertension, people with diabetes, they stop taking the tried and tested medication and go in for these supplements and herbal things, and then they come in just to die, basically to die. At the end, they come into the hospital, destroying people's livers and so on. There are good ones, but there are also lots of charlatans around, and people do all sorts of things for money. And it's difficult to tell who is genuine and who is not. If someone is telling you he has a medication which can cure hernia, for instance, if you understand how hernia comes about, it's basically your intestine. If the ordinary hernia is mostly your intestines or some other parts of your bowel penetrating or protruding through a space and coming out. So the person says he's going to give you a medication which is going to melt your hernia. Is the person going to melt your intestine? It really doesn't make any sense for anybody to tell you these things. But people go around selling these drugs, and unfortunately, we have a very gullible society. Interestingly, now my opinion has even changed on that. I used to think that it was because of literacy rates are low literacy. But clearly, COVID has taught us that it really isn't about formal education. It has a lot to do with mentality, because you find very educated people buying into all sorts of very funny conspiracy theories, buying into all sorts of street talk about what is true and what is not true. So the system needs a lot more, needs an what do you call that?
Needs to be overhauled.
Overhauled. That's the word I'm trying to think about. The system needs to be overhauled. And I'm not too sure I have the solution, the absolute solution to it. But I think we need to tighten regulation. That I'm quite sure of. That we need to tighten regulation. Absolutely tighten regulation. We also need to chase people on ethical grounds. We do as healthcare workers, we do so many unethical things in Ghana, and we're able to get away with them. Now people are beginning to question healthcare professionals a bit more in Ghana. But previously, healthcare professionals were unchallengeable and unquestioned. And so we did so many unethical things, like people in the hospitals, nurses, doctors, and so selling medication. Sometimes it happens, and you see those things. So it's the whole system of regulation, of taking people on for ethical reasons, really needs to be done. And then proper education. And we should not, in the proper education, I do not mean formal education in school, but civic education. These are things people should understand. Everybody in the population should understand.
Thank you again, viewers, for your time. We are still speaking to Dr. Justice Boakye-Appiah, a medical doctor from Ghana, currently pursuing a PhD in St. George's University of London, United Kingdom. And we've had a very interesting conversation with him so far. I'm really enjoying that. I've learned a lot throughout this conversation. Dr. Boakye-Appiah, we still want to understand your position on some of the few social issues. Recently, I saw a post from you, or two different posts, one talking about life expectancy with respect to current generation and the older generation or past generations. People think that currently we are not living longer compared to previously, but you have a different opinion. And the other post also talks about the role of extracurricular activities, and you use example of you playing violin, people getting scholarships into top universities because of music and sports and other things. Can you expand on this for us? Thank you.
On the life expectancy thing, I'm not even too sure it's an opinion. I think it's the figures are there. So every country has a known life expectancy, and you can follow the trend over the years. And the trend shows that as far back as the 16th century, I think I even saw some graphs going as far back as the 15th century, Africa, that is not specific to Ghana though, but Africa in general had a very stable life expectancy, around 40, 50, 40 thereabouts for a very long time. And then in the 20th century, it started rising gradually. We are currently, I think, somewhere around 59, 60 in Ghana specifically. And Ghana's life expectancy graphs, the oldest I have seen, goes back to, I think, the early 20th century, so 19 somethings. And it has been on a steady rise. So as it currently, we are living averagely up to 59, 60. But previously it was less, 40 and so on. And I think, why did I even say that? I think I had a discussion with somebody on the same thing we're talking about on herbal preparation and so on. And the person had said, Yen and Anum were using the herbs and they were living longer. And you are saying we should go and do drug trials for our herbs. Were there any drug trials in Yen and Anum? I was of the opinion that, look, the herbs may work. I don't doubt that at all. I do not doubt that at all. But I think that it has to be proven. In the time of our ancestors, the herbalists gave these medications, these herbs out for free. They didn't make any money out of it. The intent was purely altruism, purely altruistic. It wasn't about benefit, financial. But now, someone is doing these things for money. And once money is involved in something, you cannot just take people's words for it. So you should be sure that what you are taking. And with the rise in kidney problems in Ghana, liver problems in Ghana. If you speak to the doctors in the hospitals, they will tell you there's a huge. I mean, alcohol and many other things play a huge role in this, but herbal medications also play a big role in that. Not because the drugs are not good, but if you take paracetamol, for instance, let's say the original compound or molecule of paracetamol is from a tree, it's from plants. Okay, I mean, is a more common example. The artemisinin, which is used to treat malaria, I mean, which we find in artemisinin and all those things. Artemethylamine, all So you pick it in plants. Okay, what you do is that plant, that tree leaf or bark contains so many other things apart from the active ingredients you are interested in. But the active ingredient that cures the malaria is the artemisinin. Every other thing you don't know. It could be toxic, it could be poisonous, killing people. So ideally, you are interested in a very, very specific part or molecule within the whole thing. Burdening your kidneys and your liver with other things which may have effects you do not know could be problematic. So you may be solving malaria, but causing other problems. And that is why what we do in orthodox medicine is to extract the ingredient of interest, the exact thing that you are interested in, to prevent the potential toxicity of all the other things. So the herbal preparations can be safe, they can be good, they can be know that as much as possible they should be purified. Even without the purification, let's take it to proper trials. I keep saying, let's take it to proper trial. Let's make sure this is safe for human consumption first, and then after that, it really does what they say it does. So this was the discussion which brought up the whole idea of when our forefathers are over. And we looked at the graphs, and clearly we are living longer than our forefathers lived. What people say is my grandfather lived up to 90 or 95, and now I don't see anybody living up to 90, 95. But what they do not know is that, or what they forget is that this has to do with statistics. You draw the Gaussian distribution, and you have people on the extremes, but majority of people should fall within the middle. That's the statistics of it. Majority of people were within the middle, and the middle was around 40 and less. People were dying. So if you were born in Ghana, for instance, in the 1960s, the chance was that out of every 10 children who were born in Ghana in the 1960s, 2 of them were going to die before age 5. That was a definite statistic. Childhood mortality was high, but now that the values have gone down, it looks better than before. So our forefathers were not living particularly longer on the average. For any person you saw who lived up to 95 or 90 years, there were maybe 9 or 8 other people who had died under 40 or under 50, and that person had survived and is on the extreme. But that's not the common thing. The common thing now is that most of us are around 60. That's the more common thing. We will still get some people around 95 and 100 and so on, but that has never been the norm. And if you see one in your house, it doesn't mean that is what it is everywhere. In other places, people died much, much younger. Extracurricular activities. So, as I mentioned, my family, we grew up in a very liberal home. My parents allowed us to do what they wanted to do, and we weren't really restricted in anything. So we grew up taking interest in all sorts of things. We weren't really pressured to study much. We watched TV, we played football. I played a lot of basketball, and then I stopped, I think, somewhere after secondary school. But even in the university, a few times I played. My younger brother, took up. He liked a lot of politics, and he still does radio and so on. When he was in school, he was. I think he became the SASU president in Ghanaian University, BNI. So, and now he still has some political interest. He does other things around and his business and so on. But I growing up, I came to see the power of having something else beyond the books, and this actually became rife in the medical school when now I started in a class with very brilliant people, the creme de la creme, people who came to the medical school with 7 A's, 8 A's, 6 A's, and so on. And medical school is not easy. It's a lot of work. And sometimes we found even those who came with 8 A's would trail courses. They would fail some of the courses and have to resit. People with 7 A's, they would have to resit. And it was so involving and consuming that if you did take care, you would have no time to do anything else. And people just focused on that only, knew nothing else. We didn't spend time on anything else, didn't even have a social life, nothing. Now we finish school, and as one of my seniors said, in medicine nobody gets first class, everybody gets a pass. That's what everybody gets. We all get a pass. So we all have passes. We are all doctors. What next? And then life becomes boring and frustrating for some people. Nothing else to do. But I think I've seen opportunities spring up in many other things outside the books, and I have seen people get big opportunities simply because of something else they know how to do. Having a good personality, having good PR skills, having been able to socialize. As Prof. Planjou once told me, the golf course, I know you think we come and chase a ball and you think it's a stupid thing we do, but to be honest, this is where the biggest contracts and discussions are had. People come and have, while they're playing the golf, they form all sorts of allegiances. My current head of institute has we have a private funder for a research project. I think he gives the institute about £5 million every year. Was it every year or over 2 years? I don't remember the exact, but it's about £5 million that he's given to the institute. And how did he come about that grant? He plays golf. So, and the guy is a very rich man who owns a bank. I think he either owns a bank or he sits on the board of chairman of a bank board or something. And he contributed. He just said, this is what you do. I think this is good. And he gave £5 million for his research, to fund his research, by playing golf. He met him. I used the story of Ben Carson, for example. So I think life, everybody should try to be an all-rounder. Follow the things which make you happy, but try as much as possible to know as much as you can. Broaden your scope of knowledge. Be able to have interactions with everybody. And that is why I'm always grateful, as I mentioned earlier, for the kind of childhood we had. My parents exposed us to everything. So life wasn't just your privileged lifestyle in Accra. We saw life in the village. You met people in the market. You met people who came from places where there was no electricity. You met people. You knew how things were in other sides of the world. So whoever you met, you could have discussions with. If you traveled out of the country, you met white people from places. You never got intimidated by any of those things. So these things give people a broad perspective of what life is, what life should be about, and so on. And I'm always very passionate about it. So on a personal level, I play tennis. Now I play tennis. I don't play basketball anymore. I don't think I can keep up with the energy. So I play tennis. I have some musical interest. I play the violin. I do a lot of writing. I used to write under pseudonym, but I think from next month I just got into an agreement with a newspaper, quite a popular newspaper, to do regular column. So I'll be doing every week, writing a column and freelance. So it could be anything. I have some business interests as well. You try to just broaden life as much as you can, and do the things you want to do. You don't know which one will open and become opportunity somewhere for you. Everybody has certificates, or I think everybody does. Everybody has certificates.
Certainly, viewers now understand why I said he's making significant impact in his own field. And this is not even in his own field, he's gone to other areas and he's still making significant impact. Thank you so much, Dr. Boakye-Appiah. We encourage everyone to be involved in other extracurricular activities, and that is where the main thing lies now. Almost everybody has certificates now. What else do you have? Dr. Boakye-Appiah, now we are in abnormal times, COVID-19, and I think with respect to education and all the information we need, we wouldn't want to go into that because I think for now almost everybody is abreast with that. But on 3rd of April 2020, I sent you a text that I was on my way to your place of study or work, and you had indicated you were no more there. But just on 15th, which was like 12 days away, I saw a post from you on Facebook that you were hospitalized for 3 days and you were home lonely as at that time for the 12th day, meaning you had tested positive to COVID-19. Would you like to share your experience with us and probably give us a bit of education around that?
I mean, it wasn't a very pleasant experience. I'm not too sure it's one of the things I want to talk about in detail. I I didn't. I don't think I discussed it with people generally until I posted. I posted because I thought people should know this thing is real. You know, I'd been doing a series on my social media about COVID and so on.
Statistics and all that.
Yeah, and I thought people still didn't really think it was in the air. Yeah. And I would speak to friends and they still considered it distant. Yeah. And sometimes when I was sick and I wasn't well and I'd be WhatsApping with friends, they didn't know I wasn't well. And on groups, group conversations, I would realize people still had that impression that this thing is not, it's far away, it's not very possible. So just to break the myth of it, I thought, okay, let me just share. But I don't even think up until now I haven't gone back to read even the comments under that post because I don't like to dwell on negatives. As a person, I like to be happy to remind myself of the positive things of life. So I'm not too sure I want to share this, but it's real. I did get infected. Initially thought it was going to be one of those things. In the next 2-3 days, I should be fine. Had just fever because I think I'm young and strong. But by the third day, I was in a very uncomfortable situation and eventually had to get admitted because I was having difficulty breathing. Get some oxygen supplementation and things like that. But all in all, by God's grace, I'm fine. Came out well, and life has normalized. I still have my chest X-ray. It's my trophy. With my chest look like once in a while I just look at it and say, thank God. So I'm a survivor. I've been through Ebola and through so I've lived through Ebola and COVID. One caught me, one didn't catch me, but it's all by God's grace. I think it's alright.
Indeed, it's an interesting time to be hosting Dr. Justice Boakye Appiah. It's been awesome. I have learned a lot from him today, and I hope you have also learned a lot from him as well. The role of extracurricular activities, mentoring, and any other thing you can talk about or you can glean from this interview. I'm still reminding you that you are watching the Discovery Show. You can find us on Facebook and on YouTube, and the name is the Discovery Show TDS TV. And we go by the slogan, yearn to learn. Indeed, we are always in the mood to learn. My name is Precious Adadi Dudu, and I'm ably supported by James Upon and our brother Aaron Cosmos Opoku. Doc, we've spoken about research, we've spoken about your journey and all that, but specifically how you got into the PhD you are currently pursuing and the specific PhD or research topic you are pursuing, we would like to know. Are you able to share a bit of that with us?
So as I mentioned, I think by the end of my second year, I knew I would want to do a PhD after school. But exactly how it was going to come up, I wasn't too sure. And I initially thought it was going to be in physiology actually, because that was my interest. When I was in fifth year, I took an elective at the University of Oxford. So I came over to the UK. And my elective was in cardiology, was in cardiovascular medicine. The consultant I worked with at the time, I think Professor Solmeyers, and he also had a PhD in physiology.
Okay.
So when you realize, I was interested in it, he thought, okay, we could do something together. So after school, he sent me an email when I was in final year. I wasn't done with school yet, and I said I'm not done with school. So he had won a grant, had some PhD position, and said you can come and do this. Okay. So I said I wasn't done with school yet, and even after school I would want to complete my housemanship before leaving. So if you can wait for some 2 years, I'd be happy to come. So 2 years later, I sent him an email. He said, yeah, I still have money to fund the research. So that option was there for me. But during my housemanship, when I started with Phillips, my first leave month,
Okay.
I was supposed to have, I had arranged to go and do something somewhere, which was going to give me money, to go and chase money, because we hadn't been paying a salary, and I was still taking money from home and from my parents. And at the time, I think my dad, my dad said, once you're not being paid, you're still a student. So he wasn't going to increase my allowance. My mom had to be topping it up, but I wanted to make more money, so I made up my mind to go do something else in Malima. And then Prof. Philip said, no, I have some data, some TB data, so look at it and let's do a paper. So I spent that whole month writing the paper. That was actually the first paper I first authored. I was the first author for. And in analyzing that data, I found a patient who potentially was going to be the first extensively drug-resistant TB patient in Ghana, described in Ghana. He was basically resistant. He had TB, and his TB was resistant to all the first line, all the antibiotics we were using to treat TB in Ghana at the time. We couldn't test for other ones because they weren't even in Ghana in the first place. So we labeled him potentially extensive drug-resistant TB. So that paper, when it got published, my Professor Phillips' PhD supervisor, when he did his PhD, his supervisor, the person who supervised him, is called Dr. Mark Wansworth Jones. He's currently my second supervisor. So he saw it, and he was in the UK, and he sent Prof. Phillips an email and said, I've seen this paper with your name on it. Who's this person that wrote it? And Prof. Phillips, one boy I recruited who's in the clinical trial and so on. He said, okay, I'd like to meet him when I come to Ghana, because I think this is an interesting thing. So when he came to Ghana, he came to Kumasi, he was sleeping over at Golden Tulip, and then he invited me over. Myself and Prof. Phillips went to see him one evening, just for conversation and dinner. And he thought, so what are your plans? What are you going to do? And I told him I was going to leave. I had been offered a PhD in physiology in Oxford. So I was working on a PhD in Oxford, and he said, why do you want to go and do physiology? You're already working towards infectious disease. You're doing Buruli, you're doing TB. That is more of infection. Yeah. He was going on retirement at the time, and he had won a grant shortly before his retirement. But the money, he didn't want to work full time. So the money was going to be there. He didn't really have anything to do with it. So he said, okay, instead of going to do physiology, which he tried to convince me was not the best, because he thought in terms of products, and you're from Africa, infectious diseases are still a very big deal in Africa. There's big space for you if you want to go into that area. So he offered the money and said, Mark offered the money and said, I could give you the money to do whatever research you want to do. I'll find someone to actively supervise you, and then I'll come in once in a while. So I thought about it. I had discussions with people. I've heard about it. Oxford Physiology, St. George's, University of London for immunology, infectious disease and immunology. What could I do? Which one should I choose, and what could I do? But eventually the consideration was that I don't have long-term plans of living outside Ghana. And in Africa, infectious diseases are still, there's a big space for it. And the person who was going to be my active supervisor had specialty in vaccine development. In vaccines and vaccine. He's a TB vaccine person, so he does a lot of TB, mucosal TB vaccines and trials in animal trials, mice, monkeys, and things like that. So I thought, okay, this looks more prospective. And after speaking to everybody, I took that offer. So I think I left 2 weeks after my housemanship. So I completed my housemanship in September, at the end of September, last day of September. And I think I left Ghana on 15th October. So exactly 2 weeks, almost 2 weeks after my housemanship. I left and came, started. It was a very different environment, of course. Hospital clinic work is very different from the lab-based research, and this was lab-based, hands-on research. When you're in medical school, you don't do any serious lab work. So you may understand some of the theory behind some of the things, but I think your understanding is not even deep enough to be able to put it to use. The way they think, the way lab-based research runs, and the thinking behind it is very different from clinical settings. It's quite abstract, and it takes many years and many steps to get to the clinical stage. But there's a lot of building blocks at the basic science level, and I had to learn all of that. So my first year was learning. I came in basically tabula rasa, flat empty plate, knowing nothing. And having to learn skills, ELISA, PCR. Even bacterial culturing was a new thing. When we're doing it in microbiology, you joke
like that.
Nothing after that one experiment in the lab. That was it. You know, well, now you have to grow your own bacteria. You know, I have to grow my own bacteria, do my own plating and everything, protein extractions, do DNA sequencing. And you do all of those things yourself. Do your everyday ELISAs, your protein purifications yourself. Develop your vaccines. And depending on what you are doing with your vaccine, whether DNA vaccine, whether protein-based vaccines, when you're doing bacteria, using bacteria for attenuating bacteria or whatever, try it in mice. So I work on mice, infect them sometimes, immunize them other times to see if my vaccine candidate will work in them. So the first year was a learning period for me. In the first, I think I was offered a PhD. The proper PhD, after I had developed the concept now of what I thought could be a good vaccine candidate against Buruli Ulcer. 6 months, after 3 months, I was offered after 3 months, and I had started, and then there was an issue with funding because the money was apparently it was for research, but it was supposed to be given or controlled by a British national and not foreigners. So they said, you can't use it to pay foreign tuition, which was a lot of money at the time. I think it was about £27,000 per year. It wasn't money I could go and bring from Ghana, of course. But I think in my time here, I've met very good people who are not even Christians. People I've never met before who paid my tuition and paid my fees and paid me a salary for a long time while many arrangements came into play. My supervisor, the head of the institute, Professor Julian Mao, my supervisor is called Rako Relich, huge names in the fields of immunology. They had grants, put money from here. At a point, even the principal for St. George's had to come in, pull money from the top. People did everything to make sure I stayed because, they knew I had sacrificed my life from Ghana, sacrificed a PhD elsewhere to come here. And what I was doing was of interest to everybody. When my vaccine worked, it was going to be good. So they thought, let's give as much help as they could. So eventually there was a 1 month hitch where no one knew what was going to happen, but I still kept on doing the work. And after some time, they put their heads together and came up with the money. Almost £100,000, not small money.
Wow.
To pay for the tuition and everything. And to pay me a salary as well, because while I was here.
Stipend.
Well, I was a bit fortunate. They considered. I think I was in terms of ranking, I was ranked a bit higher than what I actually was. In Ghana, I just completed a housemanship, so I was basically like a general medical officer. But they thought, he's a doctor, and they probably thought I was some big doctor from Africa.
Your credentials, your work with WHO, and all that had already put you a step ahead.
So I was fortunate. So they gave me a salary. I was put on a salary, and a bit better than the normal PhD stipend, to make me more comfortable and things like that. And I went on with my work. So I had 3 vaccine candidates, which 2 of them proved to be very, very good in protecting the mice against Buruli Ulcer. So we applied for some funding, research funding. Managed to get 2 grants to fund and to do more work on it, which was again another highlight because it's not very common for a PhD student to.
Are you talking about the network validated from MRC, Medical Research Council, and then St. George's Innovation Award?
So I got two grant awards. It was over a very short period of time. I think over about 3 or 4 months period. When I wrote up the proposals and everything for innovation. And I think the second one is actually, so I've moved the work a bit from just Buruli Ulcer. I've gone back into TB, which I started again. As you may know, the bacteria which cause mycobacteria. So Buruli Ulcer and TB sort of belong to the same family in terms of the bacteria. So some of the techniques are interchangeable. So I do. I'm currently trying some vaccine candidates for TB as well. COVID has stalled my experiments because the lab had to be closed down. But I've developed some candidates for TB, which I'm still trying and hoping will give very good results. The current TB vaccine is not very good in adults. It protects children against severe forms of the disease, but it doesn't protect adults against TB that much. So there are lots of efforts ongoing to come up with a new one. There are some vaccine candidates in clinical trials, but I still want to try mine to see. My Buruli Ulcer vaccine will be patented with time. I mean, process is already. We just need to sort out a few things. Will be patented because and so the investor is happy. They are happy they invested in it and me, because I think eventually they will have a share in the patent, of course. And I'll hopefully move to Ghana with the techniques, the research techniques acquired. We'll see what the future holds.
Yeah, so for viewers who probably may not understand all the research stuff we're talking about a journey to develop a vaccine for a Buruli Ulcer disease, a skin disease that has been neglected for so long. And so it's a significant stride he's made, and that's why we are here to celebrate him. We will definitely be happy to see that out and patented in your name, and we are happy to be associated with you. We are looking forward to you climbing higher and higher so that we can also learn from you. We are already learning from you today, and we hope it wouldn't end here. We will just, you talking about you going back to Ghana with your experience and all that you've had. What are your thoughts with respect to medical research funding in Ghana, and what are you going to add up to the system we already have in Ghana?
I think it's quite obvious that there's a huge gap, not just in medical research, but in research in general in Ghana. Poorly funded. Sure. Probably 98 to 99% of all research done in Ghana is done with money from outside. And the truth is that when someone gives you money for research, there are a few people, a few funding agencies which do not really have interest in what you are doing. They are just interested in the advancement of science and humanity. I mean, people have their own opinions about Bill Gates and so on, but he tends to be one of such people. I mean, he's made lots of money. What he gives out for research is a lot, but generally will not affect his wealth anyway. But it's still a lot of money, and he contributes quite a lot. And then countries also contribute a lot. So the UK, for instance, invests a lot in research. The EU, the European Union, has a huge pot of cash with which they fund research. So there's obviously a very big gap when it comes to research funding, and not just medical research, but funding for research in general in Ghana. The attitude is not very forthright. People are not too keen on it. I think successive governments have not seen the use of investing. But of course, I understand. If we haven't had enough to eat, how are we going to put money into taking care of mice, for instance? The mice I work with, I think it's about £4 a day, or so, about £4 a day per mouse. Keeping it alive, feeding it, and someone I pay for, out of the grants, £4 a day goes to the mice. So if you convert that to cedis, that's how much is that? That's about 28 cedis for one mouse every single day. How much is the Ghanaian human being spending? And you work with hundreds, to sometimes thousands of these mice. So I do understand it's a very expensive venture, but it's a long-term investment which pays off in the end. The patents and all it's a lot of money. If you discover a drug, you have about a 30-year period or so where no one else can produce that drug, and only you are expected to produce and recoup your profits. So people, or not individuals, usually the money is so huge an individual cannot afford, but invest in companies and put in a lot of money, and then they recoup it at the end of the day, because for 30 years you're going to be the only person producing it. You definitely will make your profit and beyond. The monopoly is so big.
Yeah.
And so people, there's a big gap, but about currently I think maybe 98 to 99% of research done in Ghana is funded by foreign interest, by the German government, by the European Union. The European Union has a huge cash pot, which they put into research, and if we are fortunate, some of the money gets to Ghana. I think going forward, industry, I will not, if government is able to raise the money, we thank God, but let's also be realistic that I think that there are bread and butter issues government has to sort out first before it can get ambitious into putting things like $1 billion into research. That is money Ghana realistically cannot afford. But industry should be interested. If you have a Nestle or you have some palm oil producing factory somewhere, they should be interested in putting money, not in the hands, but into research institutions to look into how they can improve their production, to look into how they can better their products and things like that. And it's not like Ghanaians are not smart. If you go to the universities, the final year projects people do are very brilliant pieces. Of course, we all know not all of them are authentic, but people do very, very good work, and you find very brilliant pieces which, if money were invested in these people and they were given the opportunity to do what they really had in mind, we could develop so many products, so many technologies, so many patents will be developed. And in the long term, these are huge investments which have built countries. Yesterday, I was watching a documentary on the railway system, the UK railway system, and how it was developed by one guy, one engineer called Brunel. And we are talking about work he did many centuries ago. But those rail lines are worth billions of pounds now. And that is what the whole country relies on. I'm sure generations after him, his descendants are still benefiting from the money, from those things. It's a huge investment, which is worthwhile in the long term and in the long run. And if industry, if government will be able to find some little money to mobilize to promote local content. And I say local content because, of course, if the EU is funding research in Ghana, the interest is not exactly on Ghana. They are looking for what will benefit them, but they find that Ghana has potential to give them what they need, so they come and put in a few euros there. But they actually spent a lot of them, and whatever data they are getting, their interest is here. We may find a way of benefiting, but ultimately they get everything. We have issues which are necessary for us, which are important to us, and we should be interested in researching into our issues, like these herbal issues, herbal drug issues, for instance. If we were doing proper research into these things, if we were purifying the products properly, if we were doing proper efficacy trials and so on, these are things we could go worldwide with. Madagascar, for instance, had the opportunity. I personally think they missed a big opportunity with their COVID thing. If they did a proper drug trial, prove to the world that, look, this thing works, this is our data, and other countries started importing, you can imagine how much revenue they will be talking about. But now other countries are reluctant to import simply because they do not have any efficacy data, proper efficacy data to prove it. These are huge investments that if Ghana would look into, not just government, but again industry, and like I said, not just medicine, engineering, in physics, in chemistry, even in social sciences. In the social sciences, in economics, there's a lot we can do if we would put our minds to research, and we would stop a lot of the street talk that we do, which are not evidence backed. People just they say all sorts of things from this is what we believed from, but it actually may not necessarily be the truth. And we'll look into that. I think we still have potential as a country. We're not doing badly, but in research we're doing terribly. We're doing terribly, and we can improve. There's room for improvements. During this whole COVID thing, Ghana was saved by Noguchi and KCCR, basically these two research institutions. Until COVID, nobody had heard of KCCR. KCCR was in Kumasi within the university. I worked there. That was where our breeding project was based, and it was started by the Germans, funded by foreign money. Nothing from Ghana. Funded by research grants from Germany, from the EU, some from the GLRA, as they call it. I mean, money from all over the places, but it really wasn't Ghanaian. So we take sample blood from Ghanaian patients. We look into eventually the bulk of it ends up out of the country. They'll keep those samples for years and do so much with it. Develop drugs, develop therapies, develop theories on disease and so on, infectious disease and so on. And then because we are those who suffer these infectious disease more than these Western countries, they come back to sell the technology, the idea, and the medication to us. And we buy it at the very expensive. Yeah, we buy it at the very expensive. But we contributed our blood to the development of these things. But it's just a question of the money. Quite clearly, we have demonstrated we have the brain, we have the human capacity to do these things. How cases here in Noguchi have held the country down during this time is remarkable. The president has promised to set up research institutes in every region now. We hope that works out. But going forward, I think COVID has brought the issues of science and research to the fore, and the need for us to do our own things and to find our footing in terms of local content development. At the beginning of COVID, much of the data, all the projections we're doing was based on data from other countries because we didn't have anything. No, we really didn't. Going forward, we realized, the predictions weren't accurate. And they weren't accurate. Of course, they weren't going to be accurate. Our environment is different from the UK. No. So if you're using UK data to plan your life in Ghana, it's not going to work. But we can develop local content. We can be keen on solving our issues, our specific issues, tailor-made to fix our problems and to develop things of interest to us. But it involves a lot of money. It's not cheap. It's not cheap at all. It involves a lot of money.
Certainly, it's not cheap. And as you put it, we just have to sit up and be very thoughtful and plan very well and put our heads together, and we will be able to do whatever we have to do. Indeed, it's been a very exciting time. We've been here with Dr. Justice Boachiapia, a medical doctor from Ghana who is pursuing a PhD in infectious disease and immunity. He's made significant impact so far in his field, and he's already shared that with us. We are coming to the end of our program or our discussion with him, and I'm happy to say that this program is proudly supported and ably produced by Mr. James Opong, as well as our brother Cosmos Opoku Aaron, and I have been your host. My name is Precious Adadidudu. We're just coming to the final laps of everything, and Doc, just away from the research, your life and all that, just a little bit of social life. Do you have any political ambitions?
I don't think I have any specific political ambitions. And one step at a time. I don't plan too far into the future. I think that's one of the things I've learned not to do, because it hardly ever goes the way you plan it. But eventually, if you believe in God, I think He orders your steps. So one day at a time, try to live today well. You don't know where you end up tomorrow, but never say never, and never say anything for certain.
I know that from the kind of society we are coming from, the society itself put a bit of pressure on us whilst we are growing up, or when we get to a certain level. Do you get any pressure on you from family, friends, and other people who keep asking about your D-Day, your marriage, and anything like that? I've seen a lot on social media, that's what I'm asking.
My friends and I joke about my age, and I think I get teased a lot when I'm being married, but I don't think there's any pressure. Quite the number of my age mates. It's not unusual for people of my age. It's not unusual for people of my age to not be married. Some of my immediate friends are married, which is a good thing. But I mean, looking at how my life has gone, it was going to be very difficult to fit in marriage. So, my mom, I think my mom is quite concerned. She would wish I were married at this time, but she also understands that the path I took was a bit different, and I could not have incorporated marriage very early. But it should happen sometime soon.
We can glean from that, because at least you are finishing PhD soon, and
there's no pressure. I'm not bothered. I'm not bothered at all. I make jokes about it. I mean, I told my younger brother that, look, if you have the opportunity to make up your mind quite early, at least on who you're going to marry, make up your mind quite early, as early as you can, because as you grow, there's always a chance for paranoia, but I don't think there's any regret or any. It happens when it happens. It's okay. No pressure.
Sure. certainly no pressure. We are encouraging our society not to put pressure on a lot of people.
I think generally whatever you do, try to do it well. We have a beautiful country, Ghana. Ghana is a wonderful place. And as I always say, I wouldn't say it in English because I have quite a number of foreign friends on my social media or they're just like us in many other areas. And I'm sure COVID has exposed them in many ways. On COVID, Ghana has generally done far better than many of the countries we look up to. We have a good country. If we would focus, we would get things right. And getting things right has become a rhetoric. Everybody has an opinion on how we think things should go. But I think a lot of nationalism, and generally in Ghana we complain too much about things we probably shouldn't complain about. Over here they have many issues as well. Their roads are so tiny, and I find that problematic. But they are living their lives. The buses sometimes are not in the best of shape. There are railway delays. And sometimes I get to the train station and I'm saying, if this were in Ghana, it would be all over social media that the train has delayed, or this whole COVID and how it has been handled in this country. They're not exactly happy, but they're also not. They understand that things work in a certain way. We need to come to that understanding as well, put in a lot more effort rather than complain. And in complaining, the other time I was having a discussion with some friends of mine, and whether or not we have the moral right to be complaining about certain things, because it's easier for people to point fingers at politicians and say the politicians have done this and they've done that. But in a very small corner and in a small way, I personally think that there's a lot more corruption in the civil service than within the political authorities. If you've dealt with the civil service before, and people, the government, and not even government, just the ordinary workers at the ministries, everybody wants to take some bribe before they do their job. The government agencies, and these are not politicians, they are not political appointments. If you sitting there not managing money, someone who's supposed to be a receptionist or who's supposed to be a clerk, not managing money, want to extort money from me before you render a service, you can imagine what the politician who is sitting over billions will be tempted to steal. It somehow makes theirs justifiable. But these civil servants are the same people who complain so much when issues come, and we're pointing accusing fingers at other people. I think it's a systemic issue. We've all contributed to the problems of Ghana, and if we really want to fix it, the fixing will not be at the top. It will start from down there, and everybody will have to play some tiny role in it. I'm not too sure anybody can act as the wise man in this situation. We all are fault, and we need to be keen to play some tiny role. It may not be recognizable, but I'm sure in the long run, collectively, we will get somewhere. There's no hope. These advanced countries have been at what they've been at for over 200, 300 years. The UK has been in the state of perpetual national mindedness for centuries. Ghana has only been in it for just over 60 years. So we are still quite young. They've made the same mistakes we are making now. They've just gone through and have come out of it. They've gone through and have come out of it. We'll get there at some point. Things will get better. I'm very optimistic. I'm very optimistic for Ghana, and I'm sure in the long run we will do well. But God willing, as I always say, God willing, we'll do well. I think so. I believe we'll do well. We'll do well. And also on the issue of mentorship, which I'm quite keen on. As a person, I think I've been a beneficiary of very good mentorship from seniors. It's a very important rule that people should be keen on taking up. That's one of the things I noticed here, that it's ingrained in the culture that you should teach younger people. You should direct them. You don't find that a lot in Ghana. Even amongst colleagues, we are not too keen to share information. To talk about opportunities we know about elsewhere and so on. We should be keen to pass on knowledge. We should be keen to have a younger person who we bring up and who we pull up the ladder, and that is very important. I don't know how it can become incorporated into our educational system. from the beginning, but I think at the university level it should be possible. Your supervisor, your academic supervisor, should not just be a supervisor, but should also be keen on your development and your progress, and should serve as a mentor. And for young people, we should also not be too keen to jump the gun.
Viewers, certainly you will do well, and we want to encourage you to do your best as you can. And we will just borrow the quotes of Justice Dad, that sometimes, or in most cases, you have to do what you have to do and not what you want to do. Let's keep doing whatever we have to do just for the betterment of our country, Ghana. Whichever area you find yourself, please do your best. This has been the Discovery Show. Kindly subscribe to our channel on Facebook and on YouTube. The name is the Discovery Show TDS TV. Please like, share, and comment on our videos, and we will be happy you did. Thank you very much. My name has been Precious Adadidudu, and it still remains same. This program has been supported by Mr. James Opom and Aaron Opoku Cosmos. Thank you. See you some other time.